Welcome back. Michael Moore is still with us. Michael, if this had failed, if the President of the United States had failed to get this health care reform bill through the House and the Senate, he's going to sign it into law tomorrow morning here in Washington. What would have that meant for his presidency?
Well, I think it would have, it probably would have paralyzed him. Probably would have had a hard time getting anything done. And I think a lot of people, including myself, who hoped that it would pass, did so not just because of the good things that were in this bill, but also because a loss at this point, after working on this for over a year, would probably mean for the rest of this congressional session, wasn't going to be able to get anything through.
Who do you credit? Because it was only a few weeks ago when Scott Brown, the Republican from Massachusetts, won that Senate seat, deprived the Democrats of their 60-seat supermajority in the Senate. It looked to a lot of those observers out there that this was dead. Who turned it around?
The people. I think the people out there, the people of America, let their members know how they felt about this. You know, you had a very interesting poll on CNN today where on the surface it looks like most Americans are against this bill, 59%. But when they asked the second and third questions, why are you against the bill, it turned out that of those of the 59% opposed, about 13%, I believe, were opposed to it because they thought the bill wasn't liberal enough. So when you strip that away, you then had a majority of Americans, about 52%, who either supported the bill in its present form or thought the bill should have even actually have gone farther.
That same poll, by the way, just want to add, that same poll showed that 47% thought that their family's health care will now be worse off than before the bill. But this poll was taken before the roll call last night on the floor of the House of Representatives.
Yeah, I think change is hard. But I'll tell you what's harder are the millions of people, 47 million, who have to suffer through not having insurance, and then the millions of others who do have insurance but never really read their policy, and until they get sick or have a really bad situation happen in their family, and then the insurance company goes all out to try and not pay the bill or to have it only have half measures taken when people need treatment.
What does it say to you, Michael? What does it say to you that so many of the opponents on the conservative side, on the right wing, the far right, not even so much on the far right, they were saying this was a step towards socialism or even socialism. I heard one congressman from California, basically say it was Soviet-style socialism in the floor debate yesterday, Congressman Nunes of California. Yet the stock markets today, Wall Street, reacted just fine, including some of those health insurance companies, the pharmaceutical companies, the hospitals, the private hospitals. They seem to say, Wall Street seemed to say, you know what, not so bad.
Not so bad, exactly, because free money is coming down the pike, boys. You know, of course, Wall Street's very happy about this. When they talk about this being some kind of evil communist Soviet medicine or whatever, where did helping those who are sick and who are poor become such an evil thing to do? When people speak out against holding our hand out to those who are the have-nots, aren't they really speaking out against Christianity, against Judaism, against the Muslim faith, Buddhism? I mean, just about every faith actually demands that we take care of those who are the least among us. So I don't know what they're smoking on the Republican side of the aisle, but it's laughable, but it's actually tragic when you listen to their vile, hateful speech that comes out of them.
I think there's the deepest concern, not only from the right, but from many others, is the cost of this. And we're going to talk about that. Where's all this money going to come from to insure another 32 million Americans? We'll continue our conversation with Michael Moore right after this. Michael Moore is still with us. We're talking about health care reform, the president getting ready to sign the legislation into law. The big concern from so many Americans is how much is this going to cost? Given the huge deficits, the annual budget deficits, the national debt, some of the money will come from Medicare. The growth of Medicare, there will be some reduction in that growth to the tune over the next 10 years of $500 billion. Less money for Medicare than would have gone without this legislation. Do you have a problem with that, Michael?
Well, first of all, I think that if this is done right, and if they make the bill stronger in the years to come, we're actually going to end up spending less. We spend $7,000, over $7,000 per American on health care. The second, number 2 country is Canada, and they're a little over, I think, $3,500, half of what we spend. But we won't get there until we have a public option, or Representative Alan Grayson's bill, the congressman from Florida, where he's proposing, he's got a 4-page bill he's going to introduce. And basically, I love how we have to count the pages of the bill now, because, you know, if there's too many pages, that's a lot of reading.
It gets confusing. But let me interrupt you, Michael.
He's going to propose, but wait, he's proposing a Medicaid buy-in, where we can, any citizen can buy that as their insurance policy instead of going to Aetna or United Healthcare or some other rip-off company. So when we have real healthcare reform like that, the price of everything is going to come down. And I think that if they would also strengthen the preventive measures for healthcare in this country, and we all, including myself, took better care of ourselves, we'd find the cost of all of that going down.
But does this new law
3 years longer, like the Canadians do?
Does this new law do anything to cut medical expenses?
Well, no. Actually, for the individual, your premiums are still going to go up. The cost of all this is going to continue to go up for the individual, for the company, the small business, whoever's having to buy insurance, because the health insurance companies are still setting the rates, and the weak regulation that's in this bill isn't really going to control them. So until we take them out of the equation, and let me tell you something, they're not going to be threatened at all by this. I mean, I love the punishment factor in this. Well, there's the one part of this bill where if an insurance company does deny you medical care because you have a pre-existing condition, their fine is $100 a day per person. That's it. So, of course, they're going to weigh, geez, should I pay for this $100,000 operation this guy needs, or take the fine of $100 a day? What do you think they're going to do? They're going to take the fine. These are thieves and jackals. They have no business being around people who are ill and who need help. The question should never be asked, how much are we going to make off this? Or how much are we going to save?
But isn't that the basic the nature of American capitalism?
Yes, it is, Wolf. And that's why this economic system we have is broke, it's bankrupt, it's corrupt, it's unfair, it's not just, and we need a more democratic economic system where the people have more of a say in what's going on, and the richest 1% don't control the whole thing.
We're going to talk about your member of Congress. You're from Flint, Michigan, Bart Stupak. We're going to talk about him and what was achieved as a result of his willingness to vote yay together with his anti-abortion colleagues. We'll take a quick break. We'll continue right after this.